Hi, my name is Dr. Katherine Kramer. I'm a small animal veterinarian at VCA Canada Vancouver Animal Wellness Hospital here in Vancouver, BC. I was introduced to the field of veterinary cannabinoid medicine a few years ago by a patient. I had a lovely 18-year-old cat that came in who had so many things, very, very ill, and we were having to use horribly high doses of opioids to try and keep him comfortable. And the problem was, it wasn't working, he was sick, he couldn't eat, and as we started talking about euthanasia, his parents, who worked in the BC Compassion Club, said, why don't we use CBD? And I thought, sure, why not? We don't have anything to lose. And by the way, what is CBD? And we started this experiment, and within a few days, this cat started to eat. And after a week, he started to play. And pretty soon we were able to take him off his opioids. And he lived several more years, actually, with a very good quality of life. And after that, I was amazed, and so started to look at it for all my other palliative care patients and became more and more fascinated by it. And that really changed the way I practice. It's a very interesting time in the field of veterinary cannabinoid medicine, both scientifically and from a regulatory point of view. Scientifically, it's fascinating because every day we're finding out more and more about this interesting plant and how it works with our bodies. My hope would be one day we will have products on my shelf that I can reach for to use in my own patients. The regulatory aspect of it, I think, it's difficult to be patient with it, but it seems like we are coming along, and hopefully within the next couple of years we'll be able to use this legally. The regulatory question, especially when it comes to veterinarians, I think is a little bit tricky. What I would like to see personally would be to see a separation of hemp products, cannabis products with less than 0.3% THC, be allowed as veterinary health products, which would allow all of us to use them. I would also like to see products with higher doses of THC be prescription only. So those will be on our shelves in our pharmacies, and it will require a veterinarian to have insight and be able to prescribe those. It seems like we are spending much more time now talking about stress and fear and anxiety and emotional wellness, not only for ourselves, but for our pets as well. And there's a huge potential to use cannabis for mental health issues in people. Well, our pets, they have the same stress, they have the same fear as we do, and they have the same behavioral issues that we have. And they also have the same endocannabinoid system that we do. So cannabis actually does have a huge potential to treat behavioral issues in our pets. The most common adverse effects we see with cannabinoid products in pets typically is lethargy. Most pets can be very sleepy for the first few days, but they typically grow accustomed to that. Now, there are big differences between pets who are taking CBD products and THC. THC, we know, is very intoxicating for dogs and cats and can actually make them very, very sick. CBD products, while typically very well tolerated, can affect some pets very strangely. We can see changes in stool, since cannabis is a fiber. We can see gastric reflux and vomiting, and a few pets can actually act very anxious on it.